Welcome to an exploration of cupping therapy, an ancient healing practice now viewed through a public health lens. We will delve into its history, methods, and place in modern wellness. This traditional method involves creating suction on the skin using cups made from various materials like glass, bamboo, silicone, or plastic. This suction promotes healing by enhancing blood circulation. The practice dates back to ancient Egyptian, Chinese, and Middle Eastern cultures. The Ebers Papyrus from 1550 BC describes its use for treating fever, pain, and menstrual problems. In traditional Chinese medicine, cupping is closely linked to acupuncture, aiming to dispel stagnation and improve qi flow. It is often used to treat respiratory diseases and related conditions. There are primarily two types of cupping: dry cupping, using suction without skin breakage, and wet cupping, involving small cuts to draw out blood. Both methods aim to promote healing. Fire cupping is another technique where heat creates suction before the cup is placed on the skin. A flame is briefly introduced into the cup to create the vacuum, often seen in traditional settings. Cupping therapy is widely used for pain management, particularly for conditions like back pain, arthritis, and chronic discomfort. It offers a non-pharmacological approach to alleviating bodily aches. It helps alleviate discomfort by increasing blood flow, reducing inflammation, and facilitating healing deep within tissues. This enhanced circulation delivers vital nutrients and aids recovery. Cupping also gains traction for reducing muscle tension, improving circulation, and enhancing range of motion. These benefits contribute to greater flexibility and improved physical function. The specific mechanism through which cupping exerts its therapeutic effects remains largely unidentified. However, several theories attempt to explain its benefits and how it interacts with the body. These theories include the pain gate theory, the diffuse noxious inhibitory controls theory, and the reflex zone theory. They propose various neurological and physiological pathways for its effects. Other proposed mechanisms involve the release of nitric acid, activation of the immune system, and blood detoxification. These biological processes are thought to contribute to its healing properties. Generally, cupping therapy is considered safe when performed by trained practitioners who adhere to strict hygiene protocols. Proper sterilization of equipment and a clean environment are essential. However, potential side effects can include skin redness, irritation, mild discomfort, and temporary bruising or discoloration. These marks are usually mild and fade quickly. Preventable adverse events like scarring, burns, or infections are often attributed to errors in sterile technique or improper application. This highlights the importance of choosing a qualified practitioner. Cupping is contraindicated directly on veins, arteries, nerves, skin inflammation, or varicose veins. It should also be avoided on open wounds or compromised skin integrity. Absolute contraindications include cancer, organ failure, pacemaker use, bleeding disorders, active infections, undiagnosed lumps, thrombophlebitis, deep vein thrombosis, and unstable stroke. Relative contraindications involve acute infection, severe chronic disease, pregnancy, and anticoagulant medications. Other considerations include recent blood donation, active menstruation, and anemia. Cupping therapy is currently regarded as complementary rather than a substitute for conventional medical treatments. It should be used alongside, not instead of, prescribed medications or medical interventions. Healthcare professionals should approach cupping cautiously, acknowledging the limited evidence supporting its effectiveness for most medical disorders. Informed consent regarding potential benefits and risks is crucial. Cupping marks are a common side effect and usually fade within 1 to 10 days, indicating increased blood circulation. These distinctive red or purple patterns are a normal part of the therapy. This increased circulation relieves muscle tension, promotes cell repair, and aids in forming new connective tissues and blood vessels. It contributes to overall tissue regeneration and healing. The suction force from cupping breaks open tiny blood vessels called capillaries under the skin, resulting in these red, round marks. This is a normal physiological response. It's important to note that these marks are not true bruises that injure muscle fibers. Unlike bruises, cupping marks are superficial and do not indicate significant trauma to underlying muscles. Cupping is not advised over skin ulcers or on the abdominal or sacral regions of pregnant women. Avoid areas with lymphedema lymph node biopsy sites, skin rash, or varicose veins. Strict infection control measures are crucial, including hand washing, personal protective equipment, and disinfection of the treatment area. These steps prevent infection and ensure patient safety. Individuals with bleeding disorders or those on blood-thinning medications should also avoid cupping. The risk of excessive bleeding or bruising is significantly increased in these cases. Understanding cupping therapy from a public health perspective helps ensure its safe and appropriate use. This knowledge empowers individuals to make informed decisions about their health. Always consult with a qualified healthcare professional before considering cupping therapy. They can assess your health status and determine if it's a safe and appropriate option for your specific needs.